Thank you so much, Jesse. That makes me sound pretty great, I guess. Good morning, everyone. Thank you so much for coming. I wanted to share my experiences about living and working in a country that does not have adequate healthcare access. For years, I worked in inner city Baltimore. It's one of the sickest and poorest areas in our country. I was at a clinic for uninsured patients only. One of my favorite patients was a 62-year-old woman. She had numerous chronic medical conditions, and she had not had medical care for years and years, so everything was getting worse. She was very sick when I met her. At our free clinic, we were constantly trying to stabilize her issues using donated medications that we could find here or there, or infrequent charity specialist care. We really could not take care of all of her issues. We were just a little free clinic. She was so tenuous, and I remember every time I saw her on my schedule, I would feel a little panic, wondering if she was still alive. That's how sick she was. I was always just trying to keep her going until she was 65 years old and could get Medicare. That was a sad way to practice. Sometimes I drove her home, and her housing situation is one you would not think is possible in this country. It was freezing and teeming with pests and overcrowded with chain smokers, which exacerbated her asthma. But here's what should startle people, should startle our lawmakers really. She worked 2 jobs. She took 3 buses to her 2 jobs. She was a very hardworking woman. I don't understand why she didn't deserve health care. She made it to 65 years old, but not before her kidneys started to fail and her back pain was so bad she could barely function. Had she had insurance, those issues could have been addressed early on at a low cost, but instead, she lost much of her functionality and quality of life, and she's going to require many more tax dollars to take care of her. When I started working in North Carolina, it was after the Affordable Care Act passed, and I thought, hey, more people will have insurance. This will be easier. This will be less tragic. I don't have to cry on my way home from work. It's not that much better. It's not really better at all. Just recently, I had a young male patient who had a shoulder ligament tear. It's making it difficult for him to do the heavy lifting required by his job. He has insurance, but he had to wait 2 months to see the surgeon who takes his insurance, only to get there and find out he could barely afford the $75 copay, and there's no way he can afford the $3,000 deductible for his surgery. So instead, his shoulder pain will continue to worsen to the point that he cannot work. Is that what we want in this country? This is a piecemeal system of underinsuring people, forcing them to navigate the labyrinth of networks and copays, getting prior authorization for medicines. It's a disaster. Physicians are fed up with this. I know patients are fed up with this, but believe me, the majority of physicians are on your side. We are fed up too. We don't get to provide the care we want to the patients. Doctors are also patients. I didn't have dental insurance for 17 years. I couldn't afford it. I didn't have medical insurance for part of that time, including when I was a medical student, ironically enough. I wound up being referred to a collection agency over a $500 unpaid medical bill. And then my apartment rental application was rejected. I spent weeks and, spent hours on the phone. I had to write letters, I had to talk to bureaucrats, I had to send faxes, I had to go to the library to use the fax machine. I finally got qualified for a charity care program, and I had my parents co-sign my rental application. But had my parents not co-signed my rental application, what would have happened? If you don't have enough social supports, one medical bill can cause you to be homeless. That's awful. It's intolerable. I'm sad for my patients, but this sadness has turned into anger. Actually, rage. I'm outraged over a terrible system that is set up to only keep rich people healthy. Not only are people suffering and dying because of lack of adequate care, but even when we are healthy, we have constant anxiety about what will happen when we get sick. What will happen if we don't get insurance? What if we have interrupted coverage? What if we have a pre-existing condition? This is an anxiety for everyone. This is not just about our individual health, really. This is about so much more. Because each of us is so overwhelmed at times with our own healthcare needs and our own lack of insurance or underinsurance, we have a lot of fear. We have fear about our present and about our futures and about our families. It's harder to trust each other. It's harder to be generous with others. It erodes the entire fabric of our society, really. If each American knew that we would always have safe, affordable, comprehensive health care, we would have room to take a breath. We would have room to welcome others into our society and into our lives. This is also about power. It's not just about health, and it's not just about the trust we feel. It's about the power in our society. When most of us are uninsured or underinsured, we are so mired in our own struggles that we cannot do the important political work that we need to do right now. We need to be questioning the economic and social structure of this country, including the healthcare system, and we need to be fixing the inequities that we see. It isn't sustainable or fair to live in a country where only a few people are doing very well. Ensuring free, quality healthcare for all would shift that balance of power and good fortune considerably toward what is fair and just. A single-payer system is the answer. It is entirely possible. It is long overdue, and I unequivocally support it. Thank you.